High-flow oxygen devices are able to meet or exceed the patient's inspiratory flow demands. Remember that spontaneous inspiratory flow is normally around 20 to 40 liters per minute, but patients in distress will have higher inspiratory flows. You have an order for a 40% Venturi mask, and you know that Venturi mask requires a 10 liter per minute oxygen input flow. You need to determine the total flow of this device. If it doesn't meet or exceed your patient's inspiratory flow demands, it will not function as a high-flow device. In order to calculate the total flow of a high-flow oxygen device, we first have to determine the air-to-oxygen ratio. Now, the air-to-oxygen ratio basically tells us how many parts of air there are for every part of oxygen. And the blending of the air and the oxygen of that device result in the FiO2 and the total flow. We calculate air-to-oxygen ratios by using a formula that subtracts the goal FiO2 from 100 for the parts of air. Then we subtract 21 from that same FiO2 goal. The Venturi mask that we have an order for is 40% FiO2. We subtract 40 from 100 to determine the parts of air, and you subtract 21 from 40 to determine the parts of oxygen. We end up with 60 parts of air to 19 parts of oxygen. We want a much more simplified ratio, and we want oxygen to be a ratio of 1. So we divide both sides of the ratio by 19, and the result is 3.16 parts of air to 1 part of oxygen. We can choose to leave it like this or simplify it even more by just saying 3 to 1. Now that we have determined our air-to-oxygen ratio, we can use that information to calculate total flow. The total flow equation is multiplying the oxygen input flow to the total of the air and the oxygen parts. For our 40% Venturi mask that has a 10 liter per minute input flow, we end up with 10 liters per minute times 3 plus 1. So 3 plus 1 is 4. We multiply 10 times 4, and the result is 40 liters per minute. 40 liters per minute is the total of a 40% Venturi mask with a 10 liter per minute oxygen input. Since inspiratory flow is normally 20 to 40 liters per minute, if your patient is in distress, it may or it may not function as a high-flow device. So your assessment of your patient will determine if it does function as a high-flow device, and if not, you will need to find another FiO2 and input flow, or you may even need to switch to a different device altogether. Let's try another one. What if we have an order for an air entrainment mask at 28%, and you know for that air entrainment mask, the oxygen input flow is 6 liters per minute. We calculate air-to-oxygen ratio by using that formula that subtracts the goal FiO2 from 100 for the parts of air, and then we subtract 21 from that same FiO2 goal. The entrainment mask is ordered at 28% FiO2, so you subtract 28 from 100 to determine the parts of air. You subtract 21 from 28 to determine parts of oxygen. You end up with 72 parts of air to 7 parts oxygen. Again, we want to simplify that ratio. We want oxygen to be a ratio of 1. We divide both sides of the ratio by 7, and the result is 10.3 parts of air to 1 part of oxygen. Again, you can choose to leave it like this, or you can simplify it even more by just saying 10 to 1. You've determined the air-to-oxygen ratio. Now you use that same formula to calculate total flow. The total flow equation is multiplying the oxygen input flow by the total of the air and the oxygen parts. So for our 28% air entrainment mask that has a 6 liter per minute input flow, we end up with 6 liters per minute times the total of 10 plus 1, which is 11. We multiply 6 times 11, and the result is 66 liters per minute. That is the total flow of a 28% air entrainment mask with a 6 liter per minute oxygen input. Again, since inspiratory flow is normally 20 to 40 liters per minute, if your patient is in distress, 66 liters per minute may or may not be enough total flow to meet your patient's inspiratory flow demands. Again, your assessment of how that device is functioning for that patient will determine if you leave them on it, if you change the FiO2 and the flow, or if you change to an entirely different device. Also, make sure that you like this video, repost it, and follow the Pulmonary Project for all things cardiopulmonary education.